Hello, everyone, and welcome back to the channel where we make medicine make sense. If you're ready to learn smarter, not harder, let's start crafting. Chest x rays, they can look intimidating, but today I'm going to show you how to read them step by step. Whether you're a medical student, a nurse, or just curious about learning chest x ray, this video will help you spot the key findings with confidence. Let's break it down, simplify it, and learn the systematic approach professionals use every day. Let's get started. We all come across chest x rays on daily basis. Before you start seeing those consolidations and start jumping on infusions, there are five most important things to check before you start reading to the chest x-ray. First things first, check for the patient's name, date, and time. Check the view, whether it's a PA, AP, or a lateral view chest x-ray. Check if it's a rotated film. Are those clavicles symmetrical or not? Check if it's an inspiration film or not. Can you see those 9 to 10 posterior ribs? And check for penetration. Spine should be faint behind the heart, not clearly visible. We'll be using a systematic approach to read the chest x-ray. It's called A, B, C, D, and E. Let's dive in. A means airway. Airway includes trachea, carina slash bronchi. In trachea, you'll be looking at is it midline or deviated. While checking the carina slash bronchi, you'll be checking for is there any narrowing or obstruction. Moving on to B. B is for breathing. B includes lungs and pleura. While looking at lungs, you'll be checking for opacity, vascular markings, or is there any hyperlesency. And while checking pleura, you'll be checking for any thickening, effusions, or is there any free air like pneumothorax. Moving on to C. C is for circulation. That includes heart and its borders. While looking at the heart, you'll be checking for its size. Is the cardiothoracic ratio less than 50% in the PA film? And while looking at heart borders, if there's any loss of right heart border, it signifies right middle lobe consolidation. And if it's loss of left, it signifies lingula, which is left upper lobe consolidation. Let's move on towards D. D is for diaphragm. Normally, right diaphragm is higher than the left diaphragm. So you'll be looking at costophrenic angles. Are they sharp? You'll be looking at the fact that if the diaphragm is elevated or not, which could signify an underlying phrenic nerve palsy, or is there any free air under the diaphragm, which signifies pneumoperitoneum. Moving towards our last alphabet, which is E, which is for everything else, which includes soft tissue. So you'll be checking for any subcutaneous emphysema. You'll be looking at for any devices like pacemakers, NG tubes, ETT tubes, or any chest tubes. And lastly, you'll be looking on at the bones, ribs, clavicle, spine, and shoulder, any fractures or any lytic lesions. So, important tips towards the end. It is really, really important that you always compare the current X ray with the previous one. Always check edges and corners. There are many findings hiding there. So, towards the end of our video, let's just label these anatomical areas with the alphabets we learned. A signifies the trachea, carina in the middle, and a right and a left-sided bronchus. B is for the lungs and the pleura. There's a right and a left-sided lung. And again, there is a right and a left sided pleura. C is for circulation, which signifies heart, its size, and its border, both right and left. D is for diaphragm, right and left sided. E is for everything else, which is ribs, the clavicle, and the subcutaneous tissue, and the other bones like shoulder blades. That's all, folks.